My name is Christine Cizek, and today I'll be demonstrating the venipuncture procedure. The most common indication for venipuncture is drawing blood for laboratory testing when blood is needed in quantities larger than what can be obtained from fingerstick methods. Most contraindications involve the venipuncture site. Avoid areas of skin infection, scarring, or sites at which a hematoma is present. Use the opposite arm if a woman has had a mastectomy or if any IVs, fistulas, or cannulas are already present. Remember, patients with bleeding or coagulation disorders may bleed for a long time after the procedure. Possible complications include infection of the skin or vein, thrombosis, laceration of the vein, and hemorrhage or hematoma. If a hematoma occurs, remove the tourniquet and needle and keep pressure on the site for at least 10 minutes. Vasovagal syncope is a common problem. Ask your patient if they have a history of fainting during venipuncture and consider drawing blood with the patient in a supine position. Ask them to advise you if they start to feel dizzy or lightheaded. If your patient does faint, quickly remove the tourniquet and needle, apply pressure to the site, and lay the patient down and attend to them. Make sure your patient has followed any preparatory instructions such as fasting. Explain why you're drawing their blood and what labs will be ordered. Ask your patient if they have a history of fainting, anxiety, or difficult blood draws. Gather the supplies for the procedure. You need gloves, a sharps container, a tourniquet, the appropriate needle for the patient, a needle holder, vacutainer tubes, and gauze, alcohol swabs, and band-aids or tape. Straight needles tend to be larger than butterfly needles. This one is a 22 gauge. The clear end covers a rubber-covered needle. That end screws onto the needle holder, and you can load a vacutainer tube ready to go. The other side is the needle that you'll use to stick the patient. The pink is a safety mechanism. Take off the black sheath, and the needle is bevel up ready to go. A butterfly needle is smaller, and you see flashback immediately when you enter the vein. Butterflies are good for children, elderly, or patients with difficult veins. There's tubing between both needles, a yellow safety mechanism, and you can hold the needle by its wings for control. Make sure you have the correct vacutainer tubes and you're aware of the proper order of draw. The tubes need to be labeled with the patient name, ID, date, and time. Use a tourniquet to look at your patient's arms to select a site. You can ask your patient if they know where they've had successful blood draws before. Often, patients who are difficult sticks will know the location of their best vein. Look at both arms and select a vein by how it feels, not how it looks. Superficial veins are blue and easily seen, but the best veins often aren't as obvious. You may need to check alternate sites, such as the dorsal aspect of the hand and the wrist. Be aware these veins tend to be smaller and roll more easily. Tie the tourniquet 3 to 4 inches above your selected site. You want it tight, but not too tight, and tie it with a loop for easy removal with one hand. With gloves on, cleanse the area with alcohol, starting in the center and moving outwards. Allow the alcohol to dry completely before you stick the patient. With your materials ready to go, remove the sheath from the needle and make sure it's bevel up. You can hold the butterfly needle by its wings to give you more control, or sometimes I will hold it flat between my thumb and index finger. Whichever you prefer, anchor the skin taut and insert the needle at a 15 to 30 degree angle. Once you see flashback, pop the tube into the needle holder and allow the vacuum to draw blood into the tube. Keep in mind when using a smaller gauge needle like a butterfly, the tubes will take longer to fill. To switch tubes, push the tube off of the needle in the needle holder and pop the next tube on. When you're on the last tube that you need to draw, you can go ahead and remove the tourniquet and allow the tube to fill the rest of the way. When your last tube is filled, make sure to remove the tube from the needle holder to stop the vacuum. With gauze ready, smoothly remove the needle and press down on the venipuncture site with gauze. Do not press down with the gauze before the needle is removed from the vein. You can ask your patient to hold pressure on the site while you activate the safety mechanism and discard the needle in the sharps container. Use a band-aid or tape to secure the gauze to the venipuncture site and advise the patient to watch for any signs of bruising, redness, or irritation. The same principles apply when using a straight needle, the main difference being you will not see flashback to confirm you are in the vein. You should feel a small pop as the needle enters the lumen of the vein. If blood does not start flowing, allow yourself one small readjustment of the needle. If still no blood, remove the needle and start over. When finished, remove the needle from the vein, activate the safety mechanism, and discard the needle in a sharps container. Make sure your tubes are labeled and that you've inverted them the correct number of times and centrifuged any tubes that need to be spun down before blood is sent to the lab.